the research shows us about early intervention is that the earlier you identify a child with autism, the earlier you intervene, the better the results are going to be. We know that young children with autism are missing some very specific developmental skills. If we plug those holes and build a much stronger foundation, it lays the framework to continue to build all the skills so that the children are going to meet their developmental potential.
We're looking at a developmental pathway that children will generally be on, and what we tend to find is that our kids are a little bit sort of outside of that path. Now, a lot of the parents feel quite strongly about it. Well, I'm not trying to pigeonhole my son, my daughter. That's not what we're talking about. We're talking about basic foundational skills that are actually going to help these children moving into sort of, adolescence, into adulthood, and some skills that are actually so important and so foundational that in the absence of them, we're actually going to really struggle as adults later on.
When children are first diagnosed with autism, in particular young children, there are two main areas that children need their skills to be built up. It's joint attention or eye contact and imitation. Now, eye contact, children learn by looking at other people. They watch other people, they watch what they're doing, they watch their faces. That starts at a very early age. Then they imitate what other people do. So if children are looking and children are imitating what other people do, they learn. Now, children with autism aren't looking enough and they're not always imitating, so they miss a lot of learning opportunities. Joint attention or eye contact and imitation, that's where we start with young children. And sometimes that's where we actually start with some older children as well. So after we've looked at the child's joint attention and imitation, we are going to look at play skills and we're going to look at communication skills. There have been 30 or more years of research that show us that play skills are very closely related to language skills. Children need play skills to develop language skills. Every time you bring that child's play skills up, you get more language. Further play skills, complex language. If the child doesn't develop the play skills, they don't develop the same level of language. And that's what often leads to the repetitive, stereotypical language. Rich play skills leads to natural, functional, rich language.
Early intervention is the process of how we help kids learn who are not naturally learning from their own environment. Some of the most important foundational skills that we can teach a child in early intervention is probably communication and socialization skills through play. And the reason why we target communication so heavily is because when we see an increase in the child's communication process, we see a nice correlation between a reduction in unwanted behaviours. Something as simple as give me, placing your hand out, getting them to understand those words, give me, means hand the object to me. It could be pack away, it could be come here, it could be my turn, some play skills. We need to make sure that we're not teaching arbitrary skills to a child. So we need to make sure that they're functional parts of their everyday life.
When we're talking about early intervention in the context of autism, and particularly a child who's been diagnosed very early, what we try to do is to make sure that that child can learn. Because what we don't want is that child developing a learning disability. So we want that child to be their best. And children learn from other people. They learn from looking at other people and doing what other people do. So imitation or social learning is critical. That's how we all learn. Sometimes symptoms associated with autism may prevent that child from learning. And so we want to make sure that that's not happening. So it's about looking at what the child's challenges are to that child being able to learn, and minimizing those challenges in a learning environment and making sure every opportunity is a learning opportunity for that child.
So when I'm thinking about what we should teach kids and why we should teach things to kids and very young children, I'm really thinking about what is the overall aim, and I want them to grow into adults who are able to make decisions about their life, have control over what happens to them, can decide on what they want to do and when they want to do it, and they have all the skills to have as much autonomy over what happens to them as a child without autism or growing into an adult without autism. As they grow, they can have the same opportunities and the same experiences, and if when they get to school and they really want to have friends, I want them to have the skills to do that. It is still about how can we create opportunities for this person to have as much control over their life as they possibly can. Although we're talking often about very young children, that is the picture that's in my mind. What does this mean in 5 years' time? What does this mean in 10 years' time?
The first thing that I always want parents to do is to actually understand autism, which is a big question, but I also want them to understand their particular child's version of autism. Where are their child's strengths and where are the areas that their child actually needs to build up more developmental skills? We want them to then understand how they can begin to work slowly, bit by bit with their child to follow some very early things through at home, because that increases the intensity in therapy and it also gives them that power to know that they're following through.
Your therapist is the person who's going to guide you on the level that your child is at that current moment. And it's important as a parent that when your child is in therapy with the therapist, that they're not just learning how to do that skill with a therapist in the therapy room, that they're also learning how to do that skill with you in the therapy room and then also you at home, so that you can generalize and maintain that skill in the home environment, because that's how it's going to work. The child isn't going to maintain that skill if you as the parent aren't practicing that skill in a natural environment. Imitation skills are probably one of the most foundational skills you can teach a child, because that opens up a pathway for language and for play skills. If you can teach a child to imitate in a therapy-based format and then generalize that to a natural environment, you are giving them the best gift that they will ever receive. They are going to learn how to learn for themselves in a natural context.
The things that I think really matter and the things that we really focus on when we're doing early intervention, what's important right now, and that might be what skills does the child need to just get along in life, or what's important to the family. And then we also take this longer view of what's going to be important for that child in their future and how do we think about that now and then sort of work backwards from there. So some of the things that really jump to mind are communication. You know, can the child ask for what they need in life, and how do they get along with others, and are they coping okay with what's happening in the world, and how do they occupy their time, and what do they do to, you know, find joy and do things to entertain themselves. And I think one thing that comes up that's really important for families is teaching kids those sort of daily self-care skills, because I know as children get older, that becomes something that families really identify as something that they want to focus on and work on.
Intervention should be based on a developmental sequence, so that you'll meet where the child is at and then you build up every area gradually. If you go too high, it's not going to work. You're going to get stuck because you haven't built all the levels of developmental skills in between.
So it's really important to think about what are the foundational things that my child needs to then be able to be functioning later on down the track with any supports that they do need, but also without having me there or needing me there 24/7. All of our kids will have strengths in some areas, deficits in others. We want to use those strengths to actually fade the challenges that we have. So it's important to recognize that, because I think it's very important both for self-esteem, but also because we actually have the skill base there. Let's do something with it to actually feed the areas that we find a little bit more challenging.
The role of the family is important and really varied, and I think some part of that is families sitting down and thinking, what is it I really want for my child? What am I going for? What am I shooting for? And then how do I make that happen? So there is a role in thinking really deeply about what you want your child to learn. There's also a role in going out and seeking that and finding the people that can help you get there or can wrap around your child. And there is a really practical role too, and I feel like there's a balance with that, because we definitely say families should be involved and, you know, do as much as you practically can, and with the resources and the sort of, you know, emotional investment we know that takes. So I think it's always a balance of do what you can practically, but also cut yourself some slack if there are moments that you can't.